Good morning, everybody. We have a number of participants on the call, more joining, but we're going to press ahead. I do hope everybody can hear me clearly. Thank you so much for joining us for this ENN hosted webinar on multisectoral nutrition programming. It is such a pleasure for us to get to share the work that we've been doing over the past years based on 8 detailed country case studies. And I have to say, we're particularly thankful for you all joining us this morning from different parts of the world, given the very unusual and challenging times that we're all confronting at the moment with COVID-19. So we're delighted to see so many of you being able to join us for this webinar. So thank you for that. My name is Carmel Dolan. I am one of ENN's technical directors, and I'm going to be chairing the next hour and 15 minutes. And I'm also joined by a number of my colleagues in ENN, Jeremy Shoham, who is a fellow technical director, Natalie Sessions, who is our global knowledge management coordinator and has been particularly intimately involved in the work behind the multisectoral nutrition programming case studies. We're also joined by Charulata Banerjee, who is our knowledge management specialist in the Asia region, and indeed by Laura Delfino, who is the ENN administrator. We have a very interesting agenda that's really an agenda in 4 parts. I'm going to set the scene really just for 2 or 3 minutes to provide you all with some background to this webinar and the reasons that we've undertaken the work that we're going to share with you. We're then going to hear from 2 colleagues, one based in Ethiopia, Dr. Sise, who many of you may know, who is the government representative for the Sokoto Declaration. And we're also joined by our colleague, who was previously in Nepal, but is also based now in Ethiopia, on some of the reflections from the Nepal experience. So Natalie will introduce our colleagues speaking on country examples in a few moments in more detail. Part 3 of this agenda is we're going to move into the key findings that have come out of these 8 detailed case studies on multisectoral nutrition programs. And those presentations are going to be made by Natalie and Jeremy, who will be tag teaming on that presentation. And they're going to talk for roughly 25 minutes. And then we've left about 10 or 15 minutes towards the end of this meeting to allow all of you listening in and joining this webinar to comment, to pose any questions so that we can do our best at answering those. But what I would ask is that everybody listens very carefully to the presentations and then write down your comments or questions, and I will circle back to you and ensure we leave plenty of time for you to contribute to this webinar. By way of setting the scene for you all, I just wanted to pop up this slide. The reason being that many of you will know that are sitting on this in this meeting that multisectoral nutrition programming is not really a new approach. It's been around for quite some time. And indeed, we can go all the way back to the 1970s. And we popped up here a very, very powerful paper written by John Field Osgood back in the early 1980s, a very well-written paper that we can share with you all after this meeting, but it gives a compelling account of the attempts to locate nutrition back in the 70s within national concerns to get nutrition awareness within the development agenda, really around enhancing human capital and productivity, and to get away from what was a more common view of nutrition at that time, which was around the sort of role of magic bullets. So what this paper does, and I think what we can learn from a lot of publications since the 1970s, is sort of chart the meteoric rise, as John Osgood Field calls it, around multisectoral planning, multisectoral nutrition implementation, and indeed, during the 1970s, its equally meteoric decline. And then through the 80s, of course, we saw multisectoral nutrition programming continuing and into the early 1990s. And then it really fell off the agenda for lots of different reasons. But in the last decade, of course, we've seen a renewed focus on multisectoral nutrition programs. And in large part, that's thanks to the growth of the scaling up nutrition movement, which really has at the heart of its principles engagement this whole multisectoral, multi-stakeholder intent, which has really been the guiding principle of all of the work of the Sun movement over the recent 8 or 9 years. And a great deal of attention over this last near decade has been in setting up high-level structures, networks, national plans for nutrition, costing these plans, etc. A great deal of effort. But what has perhaps had less visibility and is really the focus of this webinar is what's really happening at the subnational level, and how has this global and national multisectoral nutrition program agenda shifted implementation locally. So this is really what ENN has been trying to understand and what we've been working on since 2017. From 2017, we have undertaken a number of case studies, really trying to unpack what has been happening subnationally and how multisectoral nutrition programs have been evolving at the local level. And we've undertaken these detailed case studies following a pre-assigned criteria of how we've selected them and how we've gone about methodologically constructing these case studies, really to get down and under the skin of what's happening at the more local level in the name of multisectoral nutrition agenda. So this is really what our case studies have been unpacking and what they've really focused down on. So I'm going to hand over to Natalie, who's going to describe where the different multisectoral nutrition program case studies that we've been working on have taken place. So over to you, Natalie.
Great, thank you so much, Kamal. As you said, we looked at a total of 8 case studies. In 2017, we explored Senegal, Nepal, and Kenya. And in 2018, we looked at programs in Ethiopia, Niger, and Bangladesh. And then last year, we looked at multisectoral programming in Zimbabwe and the Philippines. We looked at a variety of different programs. Some and largely were government-led, and others were government-enabled with support from NGOs, such as in Senegal and Kenya, or support from the UN, as we saw in Niger. We also looked at a variety of contexts. For example, the Philippines is a middle-income country compared to Niger, which is classified as highly fragile. In fact, a number of these countries had different types of fragility and different challenges around nutrition. And we thought that that would be really interesting to explore in terms of how do you develop a multisectoral program in such contexts. So the previous 6 case studies have been published on our website, and you can go and look at them on that link. We also developed 2 interim syntheses at the end of each year. So there's a synthesis for the first 3 case studies and a second one for the second 3 case studies. And today we're really excited to publish our last 2 case studies from Zimbabwe and the Philippines. And we're really excited about these because they both offer rich learnings for other countries. Both were quite advanced in their multisectoral programming, and they have valuable insights into how they have overcome some of the common challenges of multisectoral nutrition programming. In Zimbabwe, we looked at the multisectoral community-based model for addressing food and nutrition insecurity for stunting reduction. Some of the key elements of this program includes participatory planning at the local level, targeting the nutritionally at risk, involving key actors such as local chiefs and headsmen, and a focus on M&E. In the Philippines, we looked at the Philippine Plan of Action for Nutrition, the PPAN 2017 to 2022, which is the latest plan that they have developed. In fact, they've had 6 previous nutrition plans, and it was developed over a 2-year period with extensive input and consultation, particularly at the subnational level. And so that's what made it different from the previous plans. It had particular emphasis on the first 1,000 days of life and aims to reduce stunting and wasting, but also micronutrient deficiencies and reduce the overweight prevalence in children and adolescents. Along with these 2 case studies today, we are also publishing a literature review and a final synthesis which unpacks the key learnings of the 8 case studies. We'll be talking through some of these key findings today. We did the literature review because we wanted to see how our learnings fitted within the broader evidence base. And we were very happy to see that there was a lot of similarities with what we were finding to what the broader literature was saying. So these also will be published today. We are very happy to also have inputs from Dr. Sisay and hopefully from Stanley. Dr. Sisay is the Senior Program Manager of the Sakota Declaration in Ethiopia, which is an innovation as part of the nutrition plan. And he's going to share some of the reflections of what has happened in Ethiopia since our case study and broader learnings, as well as Stanley Chitikwe, who's the Nutrition Chief of UNICEF, previously based in Nepal and now in Ethiopia, and to share some of his broader learnings on multisectoral nutrition programming and what he's learned from these countries.
Thank you so much, Carmen and Natalie. Good morning, good afternoon, and maybe good evening for the eastern part of the world. It's a great opportunity for me to share you the Ethiopian government experience, as well as also learn from other countries' experience in terms of multisectoral nutrition programming. Maybe to give you a brief background on the Sakota Declaration. The Sakota Declaration is Ethiopian government commitment to end stunting, and this is a 15 years commitment, and the target is by the end of 2030, the government aims to end stunting among children under two. So the declaration is has 3 phases. The first phase, we call it the innovation phase, which we are currently in. It has also a 5 years period, and the other phases are the expansion phase, which extends up to 2025, and also the last 5 years phase is the national scale-up phase, which extends from 2026 up to 2030. So during the innovation phase, we are focusing on 40 waradas in the northern part of the country. I think when we do this documentation in 2018, it was 33 waradas, but now the 40 waradas are covered, 27 waradas in Amhara region, and 13 waradas in Tigray region. As an innovation phase, we are piloting 6 innovations. The first one is a program delivery unit. I will be talking about later on. The second one is a community lab. The third one is the first 1,000 days public movement. The fourth one is the agriculture and water innovations and technology. The fifth one is the coastal warada-based multisectoral nutrition planning. And the sixth one is the data revolution. At federal level, currently 9 sector ministries are working together. I think in 2018, when we do the documentation, it was only 6 sector ministries, but considering the relevance of Ministry of Finance, Transport, and also Culture and Tourism, currently there are 9 sector ministries. In addition to the health, agriculture, water, irrigation and energy, education, labor, social affairs, and also women, children, and youth ministries. So these 9 sector ministries at federal, regional, and also district level, which we call Warada level, are working together to achieve the 10 strategic objectives of the Sakota Declaration to ensure that they are also contributing to the overall goal of ending stunting by the year 2030. So I think let me focus the last few minutes in terms of what are really the message that we want to communicate in this forum. The first one is, what are the critical subnational level changes that are really helping to achieve the innovation phase? One is, in terms of the structure, as you know, nutrition really needs leadership, where at federal level, sorry, where at national level we have the federal program delivery unit, but at regional level also, the leadership at the highest level is providing a program, providing leadership through a core team of technical experts that sits at the regional president office uh, to provide leadership of the multi-sectors that are engaged in the declaration. So one of the success factors at the subnational level is the establishment of the program delivery unit, which is chaired by the highest level of authorities. The second thing is in terms of the sectoral engagement. All the sectors have what we call it a costed sectoral plan, which is also tailored to the Warada level. So the costed Warada-based plan is developed by the regional sectors as well as the Warada sectors, so that we can engage all the sectors through costed Warada-based planning, which is district-based planning, so that each of the sectors can also know their contribution and their gaps, and also partners also come in and supplement to address the critical gaps each of the sectors will have. Another achievement in terms of the subnational level is the way we implement. The plans that all the sectors make, we call it the costed investment plan. So we have now for the innovation phase an investment plan that is driving the overall planning process. But in terms of implementation, each of the sectors also report their performance based on their plan against their target. So that implementation is monitored on monthly basis at Kabale level, on quarterly basis at Warada level, and also on biannual basis. It's also compiled and reviewed by highest level of authorities at regional level and also at federal level. So the scorecard to track the performance is also one of the key supporter for implementation. In addition to the scorecard, we also track the financial expenditure at subnational level. In terms of the resource allocated, how much is spent, and also how much is also not utilized. So we did the resource tracking and also partnership mapping with the technical assistance support from NITAN, so that we can know how much resource is going and also how much the gap. So these are the three critical elements at subnational level. But in terms of the achievements from the innovations, especially the community lab, is a process which is driven by the stakeholders at community level to identify their problems and also come up with their solutions is something that is really working well, because it provides a tailored solution at community level. So one of the innovation is a community lab that is really helping us to drive the process. In terms of the data revolution, as I said also earlier, the scorecard is one, but in addition to that, we are now also jointly with UNICEF, we are also piloting the Unified Nutrition Information System at Warada level, which is also a web-based platform to track the performances of the various stakeholders at district level. So we are now moving from the paper-based reporting to web-based reporting, but still it is at an initial stage, but this is something that really will enable us to achieve more in terms of tracking the performance. So I think the key learning is, I think the leadership ownership is a critical part, and also engaging all the stakeholders during the planning, reporting, monitoring, and evaluation is a key component of the learnings that we had in the past 2.5 years implementation of the innovation phase. I thank you.
Thank you so much, Dr. Sisse. And I really would encourage everyone that hasn't seen the Ethiopia case study. It's such an interesting approach to multisectoral nutrition programming. This way in which they're sort of innovating in real time is such a unique learning opportunity, both for within Ethiopia, but also more widely. Thank you for that, Dr. Sisse. Can I just check whether Stanley is with us?
Yes, I'm on.
Hello, good morning, Stanley. It's lovely to hear you. Thank you so much for joining us. I'm going to give you the floor now for 5 minutes for you to reflect on some of the key experiences from Nepal, even though I'm aware you're now in Ethiopia.
Okay, thank you very much. From Nepal, I think Nepal is one of the countries that has been showcased through the various case studies. Also, one of the leading countries in terms of doing the multi-sector approach since 2013. Let me indicate that Nepal is also in its second phase planning. So the multi-sector nutrition plan 1 was from 2013 to 17. And then there's a new plan that covers 2018 to 2020. So some of the experience in terms of what has worked working at local level, I think one of the areas we saw is to do integrated training manuals. So once you approach nutrition from a multi-sector, there's already a lot of training materials around just nutrition-specific interventions within the health sector. And then you have to now include again the nutrition-sensitive interventions requiring their own training guidelines. So when you add up the number of days required, you realize that that creates by itself a very big bottleneck to the ambition of scaling up intervention. So what we did, we started off with a number of training manuals for nutrition-specific interventions, and we looked at the number of days. They range from training on treatment of acute malnutrition, IYCF, maternal nutrition, and it all accounted to about 27 days. So we had to come together, and then we had to shrink it into 6-day training. So this was something that we realized can really facilitate local implementation. Otherwise, you will be constrained by the days that are required to just finish nutrition-specific intervention training. The second point, what we saw, depending on the structure of the government, where you have a federal structure, implementing at local level provides an opportunity to leverage resources at that local level. So what we saw in Nepal through advocacy efforts, 54% of the funding was coming from development partners, 24% was coming from local authorities, and then the remaining 22% was coming from national. So you look at this, you realize that actually working at that level, depending on the structure, how decentralized it is, creates also an opportunity to leverage domestic resources. The third point is to do with monitoring. Obviously, once you are trying to implement, you have to have accountability, you have to have monitoring, but the challenge comes how you pull everything together. So we were able to support the government to create what is an equivalent of UNIS that Dr. Sisa, my colleague, just presented just now. And I think this is very important because then you are able to monitor the progress and the implementation. In terms of what we can consider as success stories from Nepal, what we saw is that once you have this plan, a multi-sector plan, I think it has got the power to really bring in a number of stakeholders, including development partners. And it actually eases the burden of fundraising for nutrition. So in Nepal, we saw that there were 2 champion donors, USAID and EU, who for the past, I would say, maybe going to almost a decade, they've been behind the multi-sector efforts and providing substantive amount of funding. And then the second point, I think, linked to multi-sector, which, as you know, is a success criteria also for those 61 countries that are part of the Sun movement. Nepal was able to showcase its work, and then also was able to bid to host the Sun Global Gathering for 2019, which, based on the indication of political commitment and the number of other factors, were able to actually win the bid and hosted the 2019 Sun Global Gathering. And this is quite significant in the sense that it actually puts the country on the map globally and also heightened political will and interest. And then we also saw private sector coming on board. As we speak, there's an initiative that is funded by Bill and Melinda Gates, which is called Balio Nepal, which is a purely private sector initiative to try to increase the role of private sector in nutrition. What needs to change? I think just a few quick reflections. What I realize is that if you want to have impact, obviously there's need to build capacity of all the line ministries, because the unique thing with working from a multi-sector perspective is that probably among the partners who are part signatory to those plans, it's mainly the Ministry of Health that comes with a core set of skills in addressing malnutrition and implementing nutrition. So oftentimes it's important to consider training other ministries like Ministry of Agriculture, Education, Water, because traditionally they don't come with the institutional capacity for nutrition. So this is important. And then the other important thing, if you want to really be successful, is to use the ecological model approach where, of course, you have to consider orientation of all the local leaders. And this part is very important because then that's how you get the buy-in to create the coordination forums, but also to allocate the funding resources required to make a successful multi-sector approach. And then finally, once you have a number of partners together who are behind the multi-sector, there's need to strengthen the accountability. And this is not necessarily very easy, but one way in terms of doing it is to make sure there are very clear indicators that every ministry is contributing towards. And then as stakeholders come together, they discuss around their own monitoring and evaluation plan to see how things are going, the investment, like Dr. Sisai mentioned, also looking at financial tracking, how much every ministry is contributing. So I think this is critical to have a very robust monitoring and evaluation framework. Thank you.
Thank you, Stanley. That's such a good overview of all the good work in Nepal. I'm so glad you raised the amazing co-hosting, the hosting that the Nepalese government did for the global gathering late last year. I mean, a lot of us on this webinar attended that global gathering, and certainly from ENN's perspective, it was a really standout gathering of people concerned with nutrition. It was very productive, very illuminating, and it felt from our perspective, so the conversations were much more robust and embedded in, you know, the reality of really understanding what we're all trying to get done here in the name of multisectoral nutrition programming and some of the challenges inherent in doing that. You know, let's not pretend this is easy. It isn't. And that's really what a lot of the learning over the many decades has shown us, is that what we're trying to get done, what is being done across all the countries, is complex, but it is achievable. Thank you for that, Stanley. It's a great case study in Nepal. I'd encourage again everybody to take a look at that haven't had that advantage of seeing just how Nepal has managed to drive down some of its levels of malnutrition already, and the journey it's still on to achieve even more against WHA targets. Can I hand over now to Natalie, I think is up next, and we're going to hear for the next 20 minutes or so from Natalie and Jeremy on the key findings and learnings coming out of the 8-country case studies. So over to you, Natalie.
Great, thank you so much, and thank you, Dr. Sisai and Stanley. Also, just to say that Zimbabwe and the Philippines, we were hoping to get people to speak from both countries, but due to the current challenges of coronavirus, they weren't able to speak. But hopefully next time they can join us. So to come to some of the common findings that we found across the 8-country case studies, I think the first biggest finding that we found was that programming and activities didn't really change when sectors introduced a multisectoral nutrition response. Time and again, we heard, the phrase, it's nothing new. Sectors were pretty much doing what they had already planned to do. There were some small examples of change, such as incorporating nutrition messaging into activities. We saw that particularly in Nepal and Bangladesh. But rather what was different was how the different ways in which sectors were delivering services. So for example, we saw changes in terms of joint targeting, either at the level of vulnerable districts, where we saw this in Zimbabwe, Niger, and Nepal, or at the vulnerable household level, for example, targeting those in the first 1,000 days, such as in Nepal, Philippines, and Ethiopia. In Ethiopia, we also saw the health, agriculture, livestock, and education sectors used a shared beneficiary list of vulnerable children, which enabled convergence of services to the most vulnerable in the targeted community. So we saw changes in terms of convergence and targeting, trying to really get to a point where the most vulnerable household received a package of services. I'm now going to hand over to Jeremy to speak on the second finding.
Yes, good day everyone. On the monitoring and evaluation, which we've heard a little bit about from our speakers so far. It's been very challenging, I think, for countries and implementing partners to put together monitoring and evaluation systems, and that's been a common theme. And I think, referring back to the global gathering again in November last year, I think the need for more and better data was constantly reiterated in the 25 or so workshops. So generally in the case studies, we found a lack of indicators at subnational level which to help monitor the benefits of this multi-sector approach. There were lots of single sector monitoring and interventions, but not across the sectors. There was also a lack of consistency in terms around the indicators that were collected. So that's on the negative side. On the plus side, there were some really encouraging examples of innovative and progressive ways of monitoring. So for example, in Ethiopia, as we've heard, there's quarterly and 6-monthly review meetings are held at national and regional level to allow sectors to jointly look at the progress of their sectors and working together and to report indicators across the sectors. In the Philippines, and we heard this again at the global gathering, Philippines has instituted a performance and reward system in relation to collecting nutrition indicators, and that's definitely worth looking at. Zimbabwe, one of our last case studies, offered one of the most advanced M&E systems with what they call near real-time monitoring system involving community health workers and volunteers who collect data from the community, which is then transmitted upwards to local and regional level food and nutrition steering committees, and that is then entered into Android tablets and uploaded onto the National Food and Nutrition Council's database with key indicators measured against sets of thresholds, and they use a kind of traffic lights coding system. So on costing and financial mobilization, well, obviously, you know, if this is a new approach, it's vital that we know what it's going to cost and that there are finances available to implement the approach fully. When you embed a multisectoral approach into a national or subnational structures, you obviously need financial resources to make it happen, to implement it. Interestingly, from our studies, from our case studies, we didn't find many countries that collected data on what we would say are the added costs of a multisectoral approach and the coordination involved. Of course, a lot of countries have put together common results frameworks with costings, but that doesn't actually tell you what the additional costs of this approach are. And that is probably a gap. If you don't do that, then you can't really judge the cost effectiveness of this, of trying to scale up a multi-sector approach. And therefore it's difficult to understand what funds are needed. So partly as a result of that, we would say that most countries trying to scale up multi-sector nutrition programming are lacking funds because it's not clear what you need to dedicate funds for always, and therefore where the sources of funding should come from as well, whether it should be government development partners, etc. I think, and again, we heard this from Dr. Cisse, Ethiopia probably stands out as an example of a country where there's been huge effort to look at the requirements for this approach, and as well also the funding gaps. It's a generalization, but I would say that looking at the funding needs in more fragile contexts like Niger is even more problematic because so many development partners are involved in this approach. And of course, the reporting, the financial reporting and tracking, where you have development partners on top of governance, government becomes even more complex.
Great, thank you, Jeremy. Another finding that we saw was the need for high-level commitment and momentum to drive forward nutrition action. And most countries developed high-level platforms to support this. For example, in Senegal, the Cellule de lutte contre la malnutrition unit is overseen by the Office of the Prime Minister. And similarly, in Niger, the 3N initiative is situated in the President's office. So these high-level structures really do help to drive forward multisectoral nutrition action. Translating this commitment to the subnational level is difficult. For example, in Bangladesh, we found that high-level commitment at the national level was seen, but there was much less ownership and translation into action at the subnational level. As Dr. Sisay said, however, Ethiopia offers a very interesting solution to this, where they have dedicated human resource positions at the subnational level, this regional level, which are appointed to engage the political appointees and sector heads to drive the multisectoral nutrition agenda. Another finding, as Carmel reflected, we saw was that almost all 8 countries have a long history of designing and implementing multisectoral nutrition programs. For example, the Philippines had 6 successive national plans of action, and Zimbabwe has been rolling out multisectoral nutrition programming since the 1970s. This has played a role in softening sectors to embrace a multi-sector agenda. Sectors that already have experience collaborating seemed more at ease with executing in multi-sectoral activities. I think that goes without saying. We also saw this at the very local level. We're in a community where the different sectors are already used to collaborating. Multisectoral nutrition programming was seen as nothing new. Having a history of collaboration really helped drive forward action.
So this slide is about coordination, and it seems so obvious, really. You know, multi-sector programming is all about coordination, really, isn't it? I mean, you can't do it without good coordination. And what we found from the 8 studies is that coordination processes are highly country specific, so it's probably unwise to generalize about what's an optimal process for enhancing subnational multi-sector coordination. There are probably some general conclusions we can draw from the studies, and the first one is about incentives to coordinate. Again, fairly obvious, but you know, why should sectors come together? What is in it for a sector? And without incentives, is there a natural default, a natural barrier to working together as multi-sectors? So for example, in Senegal, there was a sense that coordination platforms which had been set up were purely for information sharing. And there was therefore a sense that actually there were too many meetings. And this was a criticism from many stakeholders who already had, you know, already working their socks off. And it was a step too far, too time intensive, and just put too much of a burden on public services. In Niger, we heard a similar thing, really. The commune level meetings was very ambitious, people felt, and ultimately proved unsustainable. Whereas in Bangladesh, there was a sense that why are we having these meetings? What's the purpose of coordination, really? That's in contrast to countries like Nepal, where you had the technical support unit, which was responsible for coordination and had a very clear agenda and work plan around meetings, which were generally seen as a valuable mechanism for decision making, as well as joint monitoring and planning. In general, you know, there's a sense that without the coordination, you're not going to sustain a momentum, but at the same time, there needs to be a perception across sectors that this is a win-win. There is that having coordination is beneficial to all. One final point, perhaps, is that, and this I guess applies to so many things in life, that coordination requires a strong and influential coordinator who can do the networking, diplomacy, partnership brokering, trust building, a lot of soft skills, really, to bring together diverse groups of people and professions, different organizational backgrounds. Okay, and then another set of findings we have around the capacity for multi-sector programming. And again, this shouldn't really surprise anyone, but a number of the studies showed that there was limited man or woman power at subnational level to successfully coordinate and implement a multi-sector approach. In Senegal, there was definitely a lot of feedback at local level that people lacked the time, resources, and skills for implementing the approach. That perhaps contrasts with a country like Ethiopia, where the program delivery unit has been essential, very critical in building capacity and leading on implementation, and accelerating engagement at federal and regional levels. And it's interesting, in Ethiopia, you know, if you look at the Ministry of Agriculture, you've got 10 nutritionists in there at federal level, really capacitating agricultural staff to have a nutrition lens and adopt a multi-sector approach. In countries like Zimbabwe and Kenya, there are real concerns that increasing the range of multi-sector activities can really overburden frontline staff, who are often poorly paid community health workers or volunteers.
Another finding that we saw was just how varied the sectoral engagement is across the different countries. And I think that goes without saying, because it is really important that it's context specific. We found such a vast array of different sectors involved, from 6 sectors in Kenya to 18 sectors in the Philippines. And the great variety in sectors embracing the multi-sectoral agenda. So for example, in Ethiopia, we saw that the Agriculture Ministry has really embraced a nutrition response, whereas in other countries, the Agriculture Ministry was less involved. In the Philippines, the education sector has really taken on board a nutrition mindset. In fact, they've got encouraged schools to have school gardens in virtually all schools, and nutrition meals. And so they've really embraced a multi-sectoral response. So there was just really huge variety across the different countries. And there's no real generic advice around which sectors should be involved or not, because it should be context specific. The other key finding that we found was around messaging and advocacy. I think it's really critical that when people really understand why a multi-sectoral response is needed and why sectors need to get on board, and as Jeremy pointed out, what's the added benefit for sectors to take on nutrition sensitive programming. The benefits of improving nutrition need to be emphasized to each sector, and sectors have to, while each sector has its own priorities and mandates, highlighting the value add to sectors for adopting nutrition sensitive activities is essential. But I think it's important to know that this takes a lot of time. For example, in Bangladesh, the NPAN2 began in its development in 2016, and when we visited, it was still, in 2018, it was still in its preliminary phase of implementation. And that really highlights just how long it takes to communicate around a multi-sectoral response. As such, these sorts of programs have more lead-in time than other nutrition-specific interventions, for example.
This penultimate slide is about the critical role of development partners in helping countries scale up. So in all the case studies, multi-sector program scale up or innovation has been done in close collaboration with non-government organizations, and in some cases mainly led by NGOs, for example, in Senegal and Kenya, and in some cases led by UN agencies as well, more so in, for example, Niger. In countries like Nepal, multi-sector approaches have been delivered at scale by NGOs. And generally, these NGOs have supported significant resources and manpower. Several countries, perhaps Bangladesh being a good example, have received a lot of technical assistance from the INGO sector and local NGOs as well, particularly around costing plans and supporting the operationalization of plans. In a country like Niger, which is perhaps one of the most fragile countries we looked at, limited resources available to government meant that there were an awful lot of INGOs involved in multi-sector programming. And the downside of that has been perhaps a lack of communication with government about what they're doing, and a lack of coherence around programming and alignment with the government approach. It's not just INGOs and NGOs. So, I mean, civil society obviously involves religious groups, for example, who've also been involved in countries like Zimbabwe and Ethiopia, perhaps working to improve people's choices around food. In Zimbabwe, for example, local chiefs and headmen have been involved explicitly in the Food and Nutrition Security Councils at subnational level. So NGOs and civil society really important in supporting this approach. So if I can just try and wrap up key conclusions, the case studies have certainly, as far as we're concerned, really helped to shine a light on the extent of progress of implementation at subnational level. You know, we've all heard a lot over the last few years about the higher level progress in terms of developing common results frameworks and costed plans and coordination structures at the upper federal level. But in terms of what's actually changing on the ground, we've had less information. So these 8 case studies, I think, have helped us begin to shine a light. And of course, with time and resources, we would have wanted to go a lot further. I should say that the Sun Secretariat have also done an additional 7 case studies, not using exactly the same approach as us, but for those of you at the global gathering, you will have seen that we worked on a presentation with the Sun Secretariat, pulling what are now 15 case studies of multi-sector programming scale up. So we have some resource there. I think it's interesting just to step back a little bit from that. And if we just think, you know, what is this all about? Well, it's about trying to reduce malnutrition in the world. And we know from the global nutrition reports that some countries are going forward with this and making progress, and others sadly are going backwards, or at least staying the same. We know that, we've got 10 years until the SDGs. We're supposed to have met the SDGs. And in the nearer term, we know that we hopefully have the Nutrition for Growth conference at the end of the year, virus permitting, in Japan. Sun are elaborating, as we speak, their roadmap 3 for their next phase. These are all important developments. But what is clear to us, and the ENN is, you know, it's very much what we're about, is that we need to keep learning from what we're doing. We certainly hope these case studies add to that learning around multi-sector programming and provide a core of work around implementation, practice, and success. What's also clear to us is that countries can really learn from each other, and how important it is that we collate the experiences of countries in an objective and fair way, so that we can learn what to do better and what to avoid doing. I think we're at a critical point, aren't we, really, with this whole movement around scaling up nutrition. So much has been achieved, and it's at the same time, it's vital that we build on this and demonstrate more and more progress. And to do this, I submit that we really need to reflect and learn from what we're doing.
Thank you very much, Natalie and Jeremy, for walking us through these sort of 10 common areas or thematic findings. Really, really useful. And thank you, Jeremy, for that, those sort of reflections at the end there. And I couldn't agree with you more. And I think many of us who are involved in and have been very much part of looking at the added value of the Sun movement would agree that the whole knowledge management learning component as we move into articulating Roadmap 3 is going to be absolutely essential. I mean, just listening to Stanley and Dr. Sisse a few moments ago, you know, the amount that they have already learned and are continuing to learn through their attempts at multisectoral programming, you know, that really needs to be something we're picking up and sharing in real time for the benefit of other countries. And many other countries also have key learning and experiences to get out as well. So before I open up to comments and questions, just to re-emphasize a couple of things to everybody on the webinar. Natalie mentioned that there is this sort of overarching synthesis of the 8 case studies, which is available on the ENN website. Today we put up 2 new case studies So this is the Zimbabwe and Philippines experience, and we're so grateful, even though our government colleagues from those countries couldn't join us today, but for their close engagement in the construction of those case studies with us. And I think also, if I'm not incorrect, we have 2 new videos that we're launching very soon on our website. So these are recordings of subnational program implementation from Zimbabwe and Philippines that will be on our website shortly as well. So do go to the website, do come back to us if you can't access any resources. We're more than happy to share them with you. I think we've said enough. I want to thank you all so much for your patience in listening. We've got quite a lot of participants with us and staying with us, I'm very pleased to see. So what I'd like to do now is really open up the floor for any comments or questions from any of you. So I will, maybe just, Lara, can you check that people can unmute themselves if they want to speak, please? And so please, you have the floor. Please do feel you can jump in at this point with comments or questions. So over to you.
Hello.
Hello, yes, go ahead.
Okay, I am Tamam Ali. I am now available remotely. I am joining you remotely from Yemen. I heard the discussion. It was interesting for me, the multisectoral approach, targeting the specific and the sensitive interventions for nutrition. And I have one question about this. The case studies, the 8 case studies in the 8 countries, they have the ownership, they have the leadership, but who is leading this? For example, so my understanding right now, every NGO in these 8 countries has this plan of multi-sector nutrition planning. Are they doing emergency response, or they are now shifting to development or to this multi-sectoral nutrition planning? So it needs long time, since this intervention needs long time to implement rather than emergency response. So my understanding, every NGOs, every single NGOs, every partner in these 8 countries, they are proposing or they are implementing this approach. Is that correct?
Thank you, Tamam. That's a really, really good question. And I was going to go to Jeremy because I think he'll also want to take us over to some work we've been looking at with Yemen as well. So over to you, Jeremy. Thank you.
So the short answer to that is no, it's not. That in the 8 countries we've looked at, the multi-sector program impetus and planning has been very much government-led, with varying supports of the INGO sector. Now, I think that's obviously very different to a country like Yemen, where, as I understand it, and as I remember from some work we've done recently on the humanitarian development nexus, which involved a case study of Yemen, there is quite a large element of multi-sector programming going on, or at least attempted in Yemen, but that has been very much within or under the umbrella of the cluster, the nutrition cluster. So it's a hugely different context, but the 8 countries we looked at are obviously not in the kind of conflict and dreadful situation that Yemen finds itself in currently. So government has been much more able to lead on this.
Jeremy, I thought maybe you might just say a little bit right now, given that we're talking here about the sort of unique context that are countries that are experiencing fragility through whatever cause, be it conflict related or climate related or economic, and the work that we've done, including Yemen, which is not so much around MSNPs, but sort of understanding how you build nutrition resilience within contexts that confront fragility. So can I just hand over to you to say a little bit about that to make people on the call aware of that work as well, please?
Okay, so actually there is a seminar, not a seminar, a webinar next week on this very subject, the humanitarian development nexus, which is going to be based on 4 case studies we've been doing over the last 2 years, one of them being in Yemen, one in Ethiopia, Somalia, and Kenya. And I think where this relates to a multi-sector nutrition approach is as follows, that in all of our countries, in all of our case study countries for this HDN work, humanitarian development nexus work, apart from Kenya, we're seeing an increase in the humanitarian response caseload year on year, especially in recent years, particularly in very vulnerable parts or fragile parts of each of these countries. And what that response largely entails is a treatment from a nutrition point of view, a treatment for wasting response, as well as some IYCF, and very little investment in what one might call long-term prevention programs, prevention of malnutrition programs. Some people refer to that as resilience building or nutrition resilience building. So there's very little development, longer-term funding going into these highly fragile contexts within highly fragile countries. And they're yet at the same time in humanitarian response plans and resilience plans where these exist, there is discussion about multi-sector approaches to preventing malnutrition, not just wasting, but all forms of malnutrition. So the question then becomes, well, how using humanitarian financing, which is the main type of financing that is available to these countries and contexts, how you can use that financing to develop a multi-sector approach, especially where most of that financing is going through development partners rather than government. And that's a real challenge for these highly fragile contexts. We have some recommendations in our synthesis report, which we'll be going through next week, as I said. But it just raises a lot of questions. You know, the case studies we've looked at are in more stable contexts where government has been able to take a lead. In these more fragile contexts, there's a very, very different dynamic going on between development and humanitarian partners and government, and the financing flows in those contexts as well.
Thanks, Jeremy. I think that's a really interesting point, and do feel you can reach out to us, anyone on this webinar, if you want to join or find out more about that webinar that will be taking place next week, that we'll be hosting, looking at the humanitarian development nexus through a nutrition lens and the whole building of nutrition resilience. Natalie, can I circle back to you for any last minute points that you want to make before we close this webinar?
Just to direct people to our website, where you can see all the 8 case studies as well as the synthesis. And you can also watch the videos that we've made from the various multisectoral programs. We made videos from the first 3 case studies in Senegal, Nepal, and Kenya. And then we will shortly be publishing the videos from the Philippines and Zimbabwe, so people can also take a look at them on ENN's Media Hub page. But thank you very much for everyone who joined today, and we hope you found this an interesting webinar.
Thank you, Natalie. And Jeremy, any last comments from yourself?
Yes, one of the challenges we have found is finding data on multi-sector programming collected through M&E systems, which might demonstrate an impact of this new approach, an impact on nutrition. We have done some literature reviews and informally reaching out to different stakeholders. Obviously, that, as was repeated often at the global gathering, that is a real gap for us, because the more we can demonstrate impact of this approach, the easier it is to convince resource givers, donors, and governments to invest in the approach. So if any of you have a particular program or are aware of a particular program, small, medium, or large, where there has been a definite demonstrated impact of a new multi-sector approach on nutrition, then we would very much like to hear about that.
Okay, thanks, Jeremy. So do circle back to us if you feel you have useful insights around data that we could harness. Okay, Jeremy and Natalie, thank you so much for the presentations. Very, very big thank you, Dr. Sisse, for sharing some of your rich learnings from Ethiopia, and also to you, Stanley, even though you're sitting in Ethiopia, but still obviously with a real passion for what's happening in Nepal.
That's correct. Thank you.
Yeah, so great. And I see there's a little message coming from Dr. Sisse to say that they have this resource tracking partnership management process and we'll follow up, Jeremy, with some
Yes.
performance data that they have available. So that's great, Dr. Sisse, thank you. And thank you to everybody for staying with us on this webinar. It's been our privilege to share some of this learning with you and some of our thoughts. So just for me to thank everybody and to wish you all stay safe and well, and we look forward to interacting with you from here on in. Thank you very much.